Hello everyone. So I'm doing this video because recently they've been opening up businesses because there were groups of people who were complaining and they were moaning and they were yelling and shouting and blocking streets and throwing up picket signs, um, protesting that they wanted the economy to start again and they wanted to go back to work, and they said if people are sick, just stay home, like it's a simple fix. And I guess they weren't realizing what was going to happen. And what has been happening more recently is the numbers of people are starting to get infected with this virus, COVID-19, better known as coronavirus. And so the numbers are starting to grow again. They're spiking in some areas, and they're also starting to see a surge in coronavirus cases. And so the news is not really covering as much of it like they should, but it is starting to get back to where it was before the shutdowns. I hate to say that. And so here it says coronavirus case surge in U.S. as reopening plans shift, and they say they slow, and I doubt that they're slowing because I've been seeing places opening left and right, and I think it gives people a false sense of normalcy to make them feel that things are going back to normal when they actually aren't. And so a rise sets off the new limbo as U.S. reopening plans shift slow. So this is an article, and I guess it really talks about what has been happening with this. So this is talking about Denver. This is just in Denver, but I didn't want to just talk about one state. I'm talking about everywhere. They are seeing surges and spikes, and I don't think that people realized the seriousness of this, that a lot of people are going to die. A lot of people are going to get sick. And so the soaring cases of COVID-19 are forcing cities and states across the U.S. to halt plans to restart their economies. And I hate to be the one to tell you guys this, but if you have a bunch of people that are sick and that are ill and that become infected or newly infected with this virus, they're going to have to shut things down again. And they're going to have to take more strict precaution and measures. And these businesses that are reopening will reclose. So even imposing earlier limits on public life, increasing worries that premature reopenings could lead to a second round of closures. And so I don't know if anybody is paying attention, but they have been promoting on a lot of articles to give incentives. They're saying that they're going to shut off the unemployment insurance COVID-19 relief that they had attached to it. And so I guess that was helping people out for the time being so that they would get extra kickback, so that if they were at home or they had been laid off, it could help them, get through the rough patch, of like maybe paying your bills or buying food and what have you. And so there's some other countries who have been hit with crises as well, but they're not faring well at all. And they're basically going to die because they don't have how would I say, the hospitals that we do. But what I was hearing this morning is a woman said she tried to call to get tests done for COVID-19, and the phone just basically, there was a recording saying that you need to go to your nearest doctor. So that was a sign or a red flag to her that the hospitals are starting to fill up again with people who are now becoming infected, or they're getting reinfected with the virus. And so with the number of new daily cases now rising in more than half of the country. The debate over whether to reimpose restrictions and push ahead with reopening is creating divides between neighboring cities and states. So right now they're not saying much about this, but even Fossey was saying that he's worried about these reopenings. And so I'm just going to scroll down. So if you hear any outside noise, I'm sorry about that. But I'm just really telling you about some of the stuff that has been happening recently. And so look at some of the articles. So some coronavirus patients lose their sense of smell for 30 plus days and may never regain it, scientists. And I'm not going to read the articles. I'm just showing you some of the things that people are not really looking at and may not be aware of. New York City Marathon canceled due to coronavirus. This is now what's going on. New coronavirus health concerns as colleges reopen contaminated water sitting in pipes. Coronavirus hospitals surge in Arizona, Texas. And so hospitalizations are surging, in other words. And so that means more people are becoming infected and more people are having to seek hospitalization. And hospitalization is people who have a much severe case of the virus than mild. And so this is some of the things that have been happening, and I don't think that they really are talking as much about it. They're probably going to start mentioning more about it as time progresses throughout the week, because the more the numbers go up, the more they start to worry and they start to think maybe we made a hasty decision in reopening some of these businesses too early and trying to force people to go back to work in environments where they can be infected. And I even seen an article where they were saying because the numbers are so large of people being infected, even if you're using all the precautionary measures to stay safe, you have a higher chance of becoming infected because so many people are sick, even people who may not even know that they're sick with the virus. So you could be just, going about your daily life, and because maybe you're in a grocery store and you're trying to buy your essential, needs, and you're around people who happen to be sick, they may not even know that they're sick. And so this puts a lot of people at a great disadvantage. If you're a person that you're the only income earner in the house, if you're a single parent, or if you're somebody that has health issues, or if you're worried about, whether you're going to go back to work or not, and you haven't been called back to work, and they've been promoting all these things that have been really stressing a lot of people out, trying to force people to go back to work who maybe your job is not even open yet because the job has a real problem that they can't open because they can't really put in place precautions to make staff safe and make whatever else a safe environment for you to work in. And I think schools is a big issue. And so I know I'm shifting a little bit gears here because think about it. You can probably ask older students to stand apart and do social distancing and wash hands and wear masks. But not everybody, even as adults, follow those rules. And now if you look at children who they're just kids, they don't know. How do you ask them to social distance and wash hands frequently unless you're making them wash hands? Then that means those are high touch areas. You have to constantly be sanitizing. The other thing is the kids can't wear masks. So how does one do that? And so that's complicated. I have heard that some places are doing what is called a staggered classroom where they have only a certain number of kids for a certain number of hours, and then they have another schedule, so they readjust their schedule so they have less numbers of children. So I don't know how that's going to work out, but I know that's going to be very frustrating for parents. Um, and it's going to change the schedule of things, especially if people have to go to a job and they have no other way to feed their families but to work. And then with the surging cases of coronavirus, um, if let's say you're working and you're on the front lines and you happen to get sick because more and more people become infected, and now you become really sick and you can't work, and this was your only means of income, it puts a lot of people at great risk, at higher risk of catching it, and at a great disadvantage. And not to mention people who are already vulnerable, which are minority groups and people who live almost below the poverty level or close to it. And that is what I thought I would reiterate in this video and mention, because I don't think they've mentioned enough. We've seen that the higher cases now are starting to also be young people. And believe it or not, I'm going to scroll down and show you the numbers here. It says residential congregate settings, skilled nurses, non-residential settings, and homeless service settings. So that this right here, this website, and I'll let you know, you can look it up on your computer or your, it's Public County of Los Angeles Public Health background information, symptoms, resources, gives you the totals, the daily totals. And also, from what I was hearing, just in Los Angeles alone, the number in a day went to 6,000 people that became infected. And so this is pretty alarming, and that's why briefly I saw where they mentioned that outside of all of the things that have been going on, like the civil unrest, and we have a lot of other issues that are going on. People worried about, the economy becoming worse than the Great Depression, and what are you going to do? And then they're talking about ending the moratoriums, which are um, the rent freezes and the evictions, and then also you could have a higher number of homeless people. But now what it looks like, it's not only going to be those worries, but also a higher number of infected and then newly sick and ill people, and maybe more deaths are coming, unfortunately. And so what I saw that was also alarming, that they're not really talking about as much, is that you have the deaths, races of people, the numbers of people that are dying. Here it has it listed. It says by ethnicity in Los Angeles County, the cases right here. And then when I looked at the age groups from 0 to 17, more than like 5,889 youth have actually been infected now. And so before they were saying kids, oh, you don't have to worry about kids getting infected. Kids can't wear masks. Okay, so now look what's happening. They actually are a lot higher in terms of getting affected than adults, who probably the reason why you see it at 3,000 or a little more than 3,000 is because they are at least wearing masks. But when you put these two numbers together, you have the age group between 18 to 40 and then 41 to 65. You have the numbers of people. These are the numbers of people that actually have contracted this virus. And so that's what that graph is. You can look at it. It's a case summary. It's the cases up here, and it says cases, new daily counts, laboratory confirmed cases. Those are the ones right here you see here. And so those numbers are a lot larger. I think they're actually larger than 6,000 if you ask me. They're growing. And so it's just not getting any better. And I think the problem here, to be honest with you, is the large gatherings, people not wearing masks. They're not really following all of the precautionary measures, and they're opening things too soon. That's my opinion. I think they jumped the gun when they started opening things too soon. And just yesterday I saw they opened the nail shop. People were waiting to go in there, and they said some of the first cases started in a nail shop in Los Angeles. And so this is what I'm seeing. So here you can look for yourself if you want to look. It even goes as far as all the cities in LA County, like Agoura Hills, Alhambra, Arcadia, Artesia, Avalon, Beverly Hills, Bellflower, Bell Gardens. You can look it up for yourself. There's the numbers of case rate, cases, deaths. And so they changed each day. And so they add new numbers, those of that they're able to report. But what I was hearing is that sometimes you have people that'll mention that they're not feeling comfortable even with these numbers because they feel that they're not giving the real numbers, that they're actually higher than this, what we're seeing. And I think the reason why that person said that is because the people are giving people a false sense of hope that people are going to go back to normal lives, pre-COVID lives. And that's not what I'm seeing here. It looks like we're going to go back to our lives of when before the shutdown happened, and we're going to end up having to shut down again if they don't watch what they're doing, which I feel like it's too little too late now. And so I feel like what's going to happen is the numbers are going to grow of people that are going to get infected. They're going to put more people at risk, and then people are going to be finger pointing and fighting. And then they're going to make a sharp decision to close because more people are going to come down with it, and hospitals are going to get overwhelmed, and that's what's going to cause them to have to reclose again because they're going to run out of equipment. The nurses and doctors are going to be overwhelmed all over again. You're going to have these stories of grief and people who can't see their loved ones and they're near death or either on their deathbed where they only have like hours to live. And so that's the grim reality of all of this. But this, I believe, is more the issue of people not really taking precautionary measures, being very self-centered, worrying more about money instead of people's livelihood. They're worried about the economy instead of people's lives. And if you don't have people that are alive to help move the economy and you're healthy, then you're not going to have an economy anyway. So having said this, I'm going to let this video go, but this is not good at all. And so if I was just to go in here and I'm looking at this doesn't look good. I don't care what people say, If you look at this, it says record-breaking hospitalizations overwhelm Arizona, Texas as governors struggle to contain the surge. And so this is happening in Arizona and Texas. And see, these are things that are right now happening where people are not able to even go into testing anymore. And so if you really want to see what's going on, I don't think this is getting any better. And so anyway, I'm gonna let this video go. And so just look at what happens here in Arizona and Texas. And if it happens in Arizona and Texas, it's definitely gonna happen in Los Angeles, because that really, to me, spells trouble when you see the numbers growing sharply. And all of this really comes, this is easy to understand why this is happening. All of this is coming because of opening things up too soon and putting people at high risk. And so that's what you're going to have. You're going to have larger numbers or cases of people that are going to fall ill to this disease. So having said that, I'm going to let this video go. So you can take a look at it at your own leisure. LA actually has the highest numbers right now of people who are getting infected, and it's not slowing down. And the economy is going to take a beating if you have a lot of people that are going to die or they're going to become ill, and then some of the essential workers are not going to be working anymore because they're going to also be newly infected people because they're getting full exposure to all these people that are coming down or getting infected with this disease. So like, comment, subscribe. Thanks for listening. Antoinette 70.